Hi, I'm Rhonda Massad from the West Island blog, and I am here with our favorite osteopath, Colleen Jorgensen. How are you?
I'm good. How are you?
Good. You are an osteopath, pain care educator, therapeutic Pilates, and yoga instructor. And that's quite the title, but I know from experience it's a very focused title. Even though it seems like there's a lot of things, it is all in the same thing. So we've been doing videos. This is our third, and this one will be devoted to question and answer. We won't keep everybody too long today, but there's been some questions, so this is your effort to answer them, and we appreciate it. The community is asking questions, and Colleen will be answering them. So let's get right to it. What is that first question that your readers have asked?
Perfect. So one of the first questions is from Lynn. Thank you, Lynn. So her question is, how do we recognize the difference between pain that we work through and pain that we need to take notice of and get help with? So that's they're all very challenging questions. First and foremost, you have to make sure that you're safe. So of course you should always check with a doctor to rule out that there's anything more serious going on. Once you have done that, you need to trust that, okay, if we've ruled everything out, now I need to trust that it's just my system that is going into overdrive. My nervous system is overexcited. It's seeing danger everywhere because the pain has gone on for long. And then you have to start to trust your instincts. Some people get a lot of anxiety if they don't have a name for what's going on with them, and I understand that. And we seem to think that if we can name our issue, there must be a solution for it, which is sometimes the case, but often not. So if you're going to have anxiety because you need an MRI or something, some sort of diagnostic test that will give you peace of mind, you have to take that into consideration. If you get that though, and it comes back and the doctors and your therapist tell you that, you know what, this is something we can work on together, then you have to trust that and start to go inward and build that body awareness and those instincts to try to work on it a different way.
Okay. Okay.
Second one is, what kind of at-home techniques can my partner do for me that might help the reduction of my pain and function while I can't go for treatment? So another great question. That's from, actually I don't have the name of that one. So, everybody's dealing with different things, but like we talked about in the other interview, the body is all interconnected. So it doesn't really matter where your pain is. Any relief you can get anywhere will help everywhere. So one of the main things that tends to go when we've been suffering for a while is our body awareness, our connection with our sensory feedback. So remember that game we used to play, Rhonda, as kids where you would draw on each other's backs and you have to guess what the person knows? Say it again.
You have to guess what
you have to guess, exactly. That's a great thing to go back to because it gets us in touch with that sensory feedback. So your partner can start, and if you're someone who's really out of touch with your body, start simple, a single letter. As you get good at that, you build that into 3-letter words. And as you get good at that, you graduate into simple math. So 7 plus 5, and then you have to say the answer.
Okay.
Okay. She also asked, is it dangerous that I'm not seeing my osteo? Could things deteriorate significantly? Look, I can't answer your specific scenario because I don't know what you're dealing with, but typically no. If you're seeing an osteopath, a physio, all of us are there to help your body tap into its own ability to be healthy. We're not there to fix you. We're not doing life-saving techniques. So your osteo is helping you. Yes, it makes things easier when the osteo or the physio can do certain techniques that help your body be less in that danger zone. But please don't be concerned or fearful. There's so much that you can do for yourself, and you will not deteriorate just because you're not getting those treatments right now.
We can head over to Colleen Jorgensen YouTube channel for tips and tricks.
Please, yes, please do. I've got lots of practices on there that will help you in this time. And after, when you start going back to your osteo again, keep doing all the things for yourself that you've been doing during this time that you didn't have access. And then I had 2 people that were asking more specific questions about neck, jaw, and pain in the head. So it's not ethical for me to give information on specific diagnoses, but what I will say is, again, work with what's working. So it becomes difficult to do exercise around the head, neck, and face. But just because you're having pain in the head, neck, and face, that's actually not the first place I would go. A lot of the tension up here has to do with how much freedom we have in the rest of our spine and down by our pelvis. So I would work on things that get the rest of your body moving, work with what's working. And then I would also do a lot of the practices that are again on my YouTube channel that help you to calm the nervous system down. Because if you're having pain in this area, it's likely that the vagus nerve is a little bit angry, for lack of a more technical term. And that has a lot to do with being in our sympathetic state. And you want to get down into that parasympathetic state. And there are many practices available on my YouTube channel to do that. Okay.
Any tips and tricks on that channel for sleeping? Because a lot of us have insomnia, me included.
You know what? I didn't, but maybe you and I could talk together about that one because that's a big thing right now.
It's huge.
I
I
would
know,
love
and
to.
I read on, you know, everyone's up all night, like and everybody's
Yes,
so confused with the sleeping. So maybe that's something we can address
I
moving.
think that would be great.
Okay, so now we know what our next video is going to be.
Yeah. I have last one. Do we have time?
Yeah, sure.
It's the hardest one. It's Anne, and Anne, you almost brought me to tears when I saw this question. The question is, why me? And it's so hard for me to answer that question. Like we talked about in our first interview together, Rhonda, asking the question, why me, is kind of giving your pain a lot of power, because it implies that the pain is something that's happening to you, when really the pain is your own body trying to enter into conversation with you. And unfortunately, asking a question like why me, which is perfectly normal, and we all do it. Everybody who's suffered pain for a while asks why me, everyone. But by doing that, it puts us into a little bit of a victim mode, and then it gives the pain a lot of power. So as challenging as it is, try to remember that it's not something that's being done to you. You're not being punished for anything. Your system, for whatever reason, is oversensitive to those messages that are coming in through the nociceptors, those danger detectors, or elsewhere. And so your nervous system is perceiving danger more than it should right now. So everything that you can do to create a sense of safety is what our system is looking for. And it's harder right now because one of our biggest, one of the best ways for us to feel safe is to look at another person's face, and someone who's smiling or has kind eyes or is using a nice, kind tone in their voice. So while phone calls and texts are decent, it's better to do like we're doing, Rhonda, to FaceTime or Zoom so I can actually see the expressions on your face. That goes a long way to calming down our vagus nerve, or informing our vagus nerve, so that we drop into our parasympathetic state. And Stephen Porges, who's the author of the polyvagal theory, has a great YouTube video out right now talking about exactly that in this time of COVID. So that could be interesting to look at.
Okay.
Okay.
We'll figure that up.
Perfect.
All right. Thanks for answering those questions. And if you have questions for Colleen, please
Have more.
put them in the comments or whatever, because she will be addressing those as we move forward in our journey through pain and COVID.
Yes. And I look forward to talking about sleep, Rhonda, because that's a really important one.
It is. All right. So that's our next one. Thanks,
Perfect.
everyone. Have a great day, Colleen.
You too.
Bye.